Where you are born and the type of environment that you grow up in can actually have significant effects on your long-term development. Children who live in more deprived backgrounds, they typically have more educational challenges and health challenges. The Preparing for Life study was developed to see if you provide support to parents during the first 5 years of their child's life, will this lead to better outcomes for those children. So for the last 18 years, I have been running one of the longest running randomised controlled trials of an early childhood intervention programme in Europe. As part of the original randomised controlled trial, we recruited 233 pregnant women from disadvantaged communities in Dublin. Every family who joined the study received some levels of supports, but the high treatment group received a 5-year home visiting programme. These home visits were really to try to provide support and education to parents around parenting and child development, using a very flexible and strengths-based approach. What we found was that the families and the children who received the home visiting programme consistently had much better outcomes than the children who did not. They were better able to start school when they were 5 years old, and now, even 10 years after they have left the programme, we see that they have improved cognitive development, better language skills, less attention problems, and are even less likely to experience obesity. So what this tells us is that intervening early in life and providing support to parents during those critical early years can really change the life trajectories of children. The programme itself has been rolled out by the Northside Partnership to 10 other communities all around Ireland, serving at the moment more than 500 families. Our research has also received international attention, and as a result, in 2024, the Department of Health and Human Services in the US has recognised Preparing for Life as being an evidence-based programme. So what that means in reality is that if an organisation in the US wants to implement Preparing for Life, they can apply for federal or state funding to do that. And as part of this, we're actually running a new randomised controlled trial in Chicago. We've already published 25 academic papers looking at the impact of Preparing for Life, and when you have such an evidence base, it really is encouraging to funders to go and invest in this programme and roll it out more globally.